Hi everyone, it's me, Melanie, your IVF nurse, and today I'm speaking with Megan. She's a genetic counselor, and I had the opportunity to sit in on one of her sessions, which was really informative. So if you're doing fertility treatments, or if you've had an appointment or consult with your physician and they are recommending PGS or genetic testing or PGT-A, I've got Megan here just to kind of give us a little bit more information for you as you're kind of beginning this step. So Megan, welcome. Thank you.
Thank you very much.
So what Megan normally will do is meet with a client and review I should let you do this, review what genetic testing is. So if you want to take it from there and just tell people what, or some of the acronyms that they might hear it is.
So there's a lot of reasons why people might meet with a genetic counselor, but we'll focus just on the genetic testing that can be done on the embryos. So there's a couple different terms that can be used for it. It used to be called PGS, which stood for pre-implantation genetic screening, meaning we're screening the genetics of the embryo before they're implanted. They've changed the terminology now, so it's now called PGT-A, like you mentioned, pre-implantation genetic testing, and the A stands for aneuploidy. Aneuploidy just means abnormal chromosomes. There are other types of PGT that can be used if people have known genetic diseases in their family, but for the most part, most people only need PGT-A.
Okay. Now, in the session that I had sat in with you, one of the things that I really liked was that you had asked the patient what was her understanding of genetic testing, and did she understand why it was recommended for her? What are your recommendations, I guess clinically speaking, why someone would do genetic testing on their embryos?
So that's something a lot of genetic counselors might ask, is kind of what do you know about why you're here and what research have you done already, because it helps us understand what we need to educate you on and how we can help how we can help you make an informed decision about what you need to know. In terms of who might be recommended for PGT-A, it depends on the clinic. Some doctors recommend it for people who are over 35. Other people might recommend it to all of their patients. Really what we're looking for is to see if the embryos are genetically normal or not, from a chromosome perspective, which we can talk about a little bit more. But people of any age can make embryos that are genetically normal from a chromosome perspective, even people who are in their 20s. So people can benefit from this testing no matter how old they are, but the older you get, the more likely you are to make embryos that are genetically abnormal, and so that's why it's often recommended for women who are a little bit older while they're doing IVF.
Okay. Now, you just briefly kind of touched on chromosomes, so I want you just to kind of break down the number of chromosomes we should have together with our partner.
For sure. So the chromosomes are like the blueprint or the instruction manual that tell the embryo how to grow and develop. Most healthy people have 46 chromosomes, and they come in pairs. We get one of every chromosome pair from our mom and one of every chromosome pair from our dad. So sperm should have 23 chromosomes, egg should have 23 chromosomes, and when they come together, a healthy embryo has 46 chromosomes. The first 22 chromosomes have numbers, and then the last pair of chromosomes determines our sex. When we do the PGT-A testing on the embryos, we can find a lot of different genetic abnormalities. We can find extra chromosomes or missing chromosomes, and it's really doing a count of the chromosomes to make sure they're all there and see which ones are normal and have 46, and see which ones are abnormal and have more or less. We can also find chromosomes that have extra pieces of genetic material added onto them, or missing pieces of genetic material that are missing.
Now, another section that you had covered was, I guess, the development of the embryo to the blastocyst and the safety of doing the genetic testing, or actually the embryologist obtaining the sample. So you did touch a little bit on safety of doing it. If you want to go over that again, and just so that people can get an idea of what we're talking about when an embryo or blastocyst is at that stage to be biopsied.
So there are a couple different techniques for how the PGT-A testing can be done. I'll go over the most common one. There are some older methods that used to be used. I think this is the one that's most commonly used now because it's generally the most safe. The way that it starts off is when the embryo has grown for about 3 days, it looks like this. It's about 8 cells big, and it has this shell around the outside of it. Normally, as embryos grow, they would usually hatch out of that shell naturally, but as we do the genetic testing, we make a small opening in that shell. We call that process assisted hatching. And then that's just day 3. We let the embryo continue to grow for 2 more days. And then on day 5, it looks like this. It's then called a blastocyst. It's about 100 to 200 cells big. And it's made up of 2 different parts of cells at this point. You can see the inner cell mass is this kind of cluster of cells here in the middle. And the trophectoderm, these are the cells that line the embryo on the outside. The inner cell mass are the cells that actually develop into the baby itself, whereas the trophectoderm cells develop into the placenta, the organ that connects the mom and the baby, and those are the cells that we use for the genetic testing. What happens is the opening that we've created in the shell on day 3, by day 5, some of the trophectoderm cells have grown out of the opening, and those are the cells that we take. We take about 5 cells and we take them very carefully to make sure the embryo isn't harmed. And a careful embryologist will make sure that they can always tell that they're taking trophectoderm cells and not taking any of the inner cell mass cells. If they're very cautious, they would rather leave an embryo safe. If there's any question as to which cells are inner cell mass and which cells are trophectoderm, they should tell you they can't safely do the biopsy and leave the embryo without the genetic testing rather than risk taking cells away and hurting the embryo. The whole point of getting genetically normal embryos is to help increase your pregnancy rate, and harming an embryo by doing the testing would be counterproductive to that. So they're very careful in taking these cells away. The embryos are then frozen and stored at your center, and just those 5 cells are sent to the lab, which is usually outside of the center where the genetic testing is performed.
Okay. Now, in terms of results, what are they looking for when they've processed the samples and your clinic is getting them? So either the physician or your reproductive endocrinologist is going to discuss this with you, or they're going to have someone, like a genetic counselor, to review it in more detail and address your questions or any questions or concerns they have about the results. So what would a patient be looking for in terms of what do they want to hear?
What they want to hear is that they have embryos that are genetically normal.
Yeah.
The word for that is euploid. That means that there's 46 chromosomes on all of the cells that they tested, and those are the embryos that your doctor is going to recommend for transfer. All of the other result types are considered abnormal types of results. Depending on the lab doing the genetic testing, they may or may not report certain result types, but for the most part, there's 2 main categories. Since euploid is the term for genetically normal, aneuploid is the term for genetically abnormal. And that's kind of the overall encompassing term for embryos that are missing a chromosome or have an extra chromosome, a deletion or a duplication. These embryos usually either won't implant if they're transferred, or they will lead to a miscarriage if they do implant. The results are usually quite straightforward because we cannot survive missing a chromosome or having an extra chromosome. We call this incompatible with life. We don't see children walking around missing a chromosome 1 or with an extra chromosome 1, for example, because we really need 2 copies in order to survive. There are a couple exceptions to this. The most common one people have heard of is Down syndrome. That happens when you have 3 copies of chromosome 21. Most embryos with Down syndrome still miscarry, but it's one of the few that can lead to the birth of a child. And since that's a chromosome disorder, this testing can screen for that as well. The second type of abnormal result is called Mosaic, and it's something that the technology's only recently developed to be able to detect. Mosaic means that the cells they looked at were actually a mixture of normal and abnormal cells, so a mix of euploid and aneuploid cells. We don't have as much data on how successful these embryos can do if they're transferred because we've only recently been able to detect them, so it's a little bit harder, and it's best if you have genetic counseling if you get a Mosaic result to learn more about the risks involved in transferring these.
And how often is it that, because you did briefly say that if the embryologist is not able to obtain the sample, if it's unclear whether or not it's from the trophectoderm or inner cell mass, how often does that happen where they get a no result? Or
I think it depends on the center doing it. I think it would vary from center to center.
Okay.
The aneuploid results that we see are more common as women get older, whereas Mosaic embryos are not related to maternal age. They can happen to any embryo at any age. So you are more likely to get an aneuploid embryo the older you are, but Mosaic embryos can happen to anybody.
All right. Wow. Thank you, Megan. I think that's going to cover our topic for PGT-A, or genetic testing of embryos. I hope you found this very helpful. Please feel free to check out my website, www.yourivfnurse.com. You can email me any questions at yourivfnurse@gmail.com. Check out my Instagram at yourivfnurse. You can subscribe or comment down below.